Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk something about these TADS now these got popular, and I didn't have all that much time for me to use and figure out exactly where we would put TADS, and didn't get to use all that many before I retired. And so I'm going to go back and talk to you about them, but we did use them a good bit, and I'll show you what we've done with them. Now, TAD is nothing but a screw, and the screws can be made out of stainless steel, where you're going to put them in and you take them out. I guess if you wanted to put them in and leave them forever in there, you might want to make them out of titanium, and they can charge a lot more for those. But they charge ridiculous prices for a screw. I mean, you may pay $50, $60, or $70, maybe $80 a piece for these little screws to screw in the bone structure. Now, where we did surgery on somebody and you raise the maxilla, we used to wire it back, but then now they use little plates with screws, and you can see those on the surgical cases that we have. Now that's what we call a TAD, or they call them screws there. They screw the bone together. Now when you screw into the bone structure, that screw tends to stay right there. I mean, you can pull on it and it doesn't change. Like if you pull on the tooth that's in there and has a periodontal membrane, that tooth will move, and you can move it most anywhere you want to. I'm going to show you that a little bit about the cortical bone in there. So let's get started on this now, and I'll try to draw it out. Now this is basically, these TADs will come with a little sharp blade in them. Now you can buy screws today that have a bit in the end of it. You can drill through a board, and then the bit will cut a hole in the metal, and it cuts it a little bit smaller than the threads on the screw, and you'll go in there and pull that board down on that metal like that. This is somewhat of a little bit right here you see on the end of that screw, but don't depend on that to start the hole through the cortical bone. You put the screw up there against it, but you figure out where you're going to go and take electrosurge and kind of trim the tissue right around where you're going to put the screw. So you don't want the tissue winding up on it. And then you tap something sharp in there, just make an indentation in that, and the screw will fit into that hole. Or you take a bit and go in and just open the hole slightly smaller than the threads of the screw. So then you can screw that screw in there, and it'll stay. It'll be solid in there. And you can do these screws with the stainless steel screws. To me, they could be just cheap as all get at. You can get some fabulous screws now. They got hard steel bits. They'll drill holes in the metal and put the screw in like that. But anyway, you can have different deals in the tops of the screws. Like here, you've got a hole, and you can run something through that hole, and you can put a wire through it and build different types of springs that you want to put on the screw. And it is unlimited what you can do with these screws. So let's get on, and here is just a view of a typodont or something. They're just showing you about the screws. You can put them in the pull teeth around, but you put the screw into a cortical area of the bone and pull that. But here we're just showing this elastic chain pulling on something you put through there, and that's just a hook for elastic chain. No big deal with that. You can actually, we learned to solder hooks on the bed. You put a hook on that and hook on it, and pull it back, and you put a TAD in the bone back here, and you can pull this back, and it won't allow this to come forward. You put it back here and pull on the screw, and these teeth then would move back, and the molar teeth would stay there. And so that's, you put those in the cortical bone, and you bond it to the tooth. And that's another view, and that's putting the TAD up in the, bonded in the cortical bone, right like that. And we put the teeth, like if we wanted to move these teeth forward, and we didn't want these to move back at all, you could go in here and put the TAD there, but normally I'd put it in the cortical bone right here, and you have the TAD coming up, and you bond it to the tooth, and that won't let the tooth go back. You bond it on the side of the tooth, and you can bring these teeth right up the back, and you'd have the tooth sitting in here, and you can pull it up where the roots would be back in like that. And these won't move back hardly at all. You put the force on the screw like that. And where we separate the palate, if I got a view here, I don't think I do. Let me see if I can get something. Okay, if you want to separate this palate on this particular case, you wouldn't have this up here, but you put a TAD in the bone on the distal of the central teeth, and you have TAD over here and one over here. It's got the hole, and you put a arch wire in here like that, and you put coil spring on here, and you put palatal separator in this area, and you put a lot of force on this, and that opens the suture. Is you have most of the bone structure on the suture is right in the anterior part of the mouth, comes down kind of like that, and you got to separate that, and then your separator in the back works on that. If you think about that, and you only have a palatal separator with stuff back in the middle here, and you want to separate, and the main thing you're separating is the anterior part of the mouth up here where most of the bone structure is, and you're pushing back here. Like you want to pull that apart, you don't pull up here, you pull back here. So we put the palatal separator back in the back part of this, and then you come between the central teeth, get on the outside of the central teeth, put 2 screws in there, and come across here with a flexible arch wire that'll slide through that little hole in the TAD, and you bend it where it won't come out, but you put spring on there, open coil spring, you pack it in there, and you've got a lot of force right up here in the front of the mouth, and we're able to separate palates on people in their 30s and a few in their 40s. You can separate the palates like that. I talked to Donald Tim, the guy who actually wrote the book on palatal separation. I was in New York, and he was speaking, and I went to hear him. And I talked to him after the program. I said, how old can you separate somebody? And he said about 17 or 18. And there was a whole bunch of people there wanting to talk to him, and I didn't say anything. I just left. I had already separated people in their 30s and some of them in their early 40s to come in there and widen the maxilla out. Somebody that breathed through their mouth and their tongue pushed the lower arch out, and the maxilla didn't develop its width, and they had a reduction in airway. You really need to spread that palate out, and the older you get it, it's better. And I found out you can actually spread the palate on older people without ever even pulling the sutures apart. You just put force on there, you can do that. But let's get back to the screws, and let's see. I'm going to go on there and show you. You buy screws, they come in all sorts of fancy things, and they charge the dickens out of you. to get the screws, and you get a little bit for drilling that is slightly smaller than that the TAD needs. It's the threads in the TAD make it bigger, and you screw that in there, and the threads actually thread themselves into this hole in the bone, and you can't pull that thing out. You just put it in there. If you're going to keep it for a long period of time, it may be best to use titanium screws. They really adapt the bone better, but you could use stainless steel, and you're going to take them out when you get through with them. So you could buy that. Now we put these TADs like you would go in and you screw them into the bone between the centrals over here, and you run a wire between here with a spring on it like that, and it's pushing apart at the front part of the mouth like this, and the separator in the palate is in the back area, and it carries that apart. And if you just use the back one, you tend to widen it out like this, and this tends to stay together. So you want to put some force in the front, and that's where you put screws on the distals of the centrals in the bone structure, and run a wire across there, and a pretty stiff wire in there with a spring on it. It's pushing out with a lot of force, and you can separate people's palates up into their 30s and maybe some people into their 40s. You can go in and try it. If it doesn't separate, you can just keep the pressure in there, and you gradually widen. So we can widen adults off palates up. I've widened them up to the people in their 80s, actually. So let's get on with this and show you. Now, if you want to, I don't have this pictures of doing this, but we tried this. Like you put the TAD up in the bone, like that. You've got a hole in the TAD. You can take a piece of wire and bend a deal like this, come down, and now you come around this way, come down and make a hook in this. And if you want to push these teeth forward, you put this in the occipital bone around the orbit of the eye on the bone that's sticking out here. You put that in there, and you screw it up in there good. You put this wire in this hole, and then you take, you come out like that, and you take a ligature and tie it so it can't come out of there. Now you take this, and you put a TAD, or you put, just bond something on the tooth, and you can spring this spring back and hook it over that, and it shoves the teeth forward. So this is a method that we want to advance the maxillary teeth a little bit. You can go on both sides and put one of these, and you can push the maxillary teeth in a forward direction like that. You can take this, and you can put you bond something back here. So you bend this thing and come over it, and then drop it behind the button you got on here, and it'll tend to move these teeth forward, and it shoves back on this orbit, the eye or orbit right up here. You come down as close to the tissue as you can get with that, and that advances the mandible. Now, if we were trying to do that, you would have to go right above where the orbit comes out over here somewhere. Put this screw in this area, come down with this deal, and you can push for the teeth to go forward that way. Now, here is the orbital bone right here. You can see this right in here. You can put that screw into that cortical bone, go down, and you can push these teeth in a forward direction, working out here rather than in the palate to try to push the palate, push the teeth out from the palate. That's kind of like picking yourself up by your bootstraps. So you can go, and here's this bone that's cut away, and you try to get into the cortical part of it, and then it'll come down at an angle out like that, and you can advance the mandible, or you can raise the teeth if you want to change the way that thing is done. You can actually pick the teeth up coming off of this part of the orbit around the eye. You put your screw in there, and you go down with something to pick it up. I think we show that another picture. Now, when you extract a tooth and you want to move this tooth into this deal, and if we don't want this tooth to move back, we want this one to move up there, then we go in on the buccal cortical bone, put a TAD. I've got a case where we show that in there, and you get this all ready before you take the tooth out. And the day you take the tooth out, you start pulling this tooth here. You put this TAD in and bond it to the teeth, and that keeps these teeth from coming back, and this will come forward. And if you do this immediately, then this tooth will move over into that space very quickly. In about 2 to 3 months, we can have that tooth over in this area right here. Now, if you don't, you leave it, this buccal bone that's out here will come in. It comes in like this, and now you've got cortical bone. If you leave it for a long time, it'll make a knife edge ridge here, and you can move a tooth in here, but it'll take it about 3 times longer to get the tooth in that space. So let me go on to the other ways we use that. Now this is just, of course, showing you the cortical bone. There's a whole lot of difference in cortical bone and in regular bone. Now this bone right here, cortical bone, is tough, it is thick, and you've got to put your TAD down in the cortical bone. Like you come in right through here. If you didn't want these teeth to move back, you were pulling the molar up here. You screw a TAD down into here in that cortical bone. The head of it comes up here, and then you bond that head to this tooth right here. And then you can pull these teeth forward, and the tooth will come in here. Now sometimes we won't run into this, so we have to finish up with some class 2 elastics or something to move the tooth. So there's just unlimited ways of using these TADs or screws in the bone structure, and they don't move. Once you get the teeth up here, you take that screw out, and that'll fill back in, and over a period of time you won't even know where the TAD was. The bone will fill right back in. The body moves this bone around, and if you want to expand the palate up here, if you just go slow enough, you won't shove the teeth out of the bone. If you just put a gradual pressure on a whole group of teeth, they stay in the bone. Now, if you want to push one tooth out, you would push it through the bone right here. But you can expand people's palates way on up. It just gradually. I've got a case we did, a guy he was 312 pounds, and he was muscled up, and we couldn't separate his palate, but I just kept putting the pressure, and it pulled the palate out. You could see the bone getting thin. I took pictures along the way. So we were just stretching the bone, and it makes the palate drop down. Like you'd be out here, and the palate will drop down as it goes apart. But you can expand almost anybody's bone structure you want to if you just put the gentle pressure without bringing them out of the bone. And you can palpate and you can feel that, and it'd show you that if you gradually push on a whole group of teeth, then the bone will just move out with the teeth. Let's see, now here's a thing, there's a little screwdriver, and a little bit, and that's the TAD you're going to screw into this hole. So it's better to drill the hole with a bit, and you won't slide off. Like if you got a round area of bone and you're trying to put a screw into here, you'll slip off unless you come in with a drill really steady and drill a small hole through that that's smaller than the threads of the screw. Then you screw the screw in there. When you take it out, that fills up with bone again. And this is a screwdriver that they bring with that TAD. And that's, the hole has to be slightly smaller than the diameter of the threads on the screw. Now, if you want to take this screw and shove something forward or backward, you can come into the orbit over here around the eye and the outside, and you can do that. You can also design these a little different. Okay, you can make one like this, where you go through the hole, you come out, come down like this. And now you can take this and you put a button on this tooth down here somewhere, and you bring this over and put it under this button, and it'll pick that tooth up. In other words, if you want to intrude an upper molar or something, you can do this, and this will carry this upper molar up, and it'll tend to kind of turn a little bit. So sometimes you have to put buccal root torque on the molar to keep it straight as it goes up like that. But you can actually lift teeth with something like that. So let's see, I think that's all I was going to show on that. But this is just giving you a touch of the many, many different ways that you can use these screws to hold one section and bring another section forward to it, or you hold these back and bring the front to the back, or you can just do most anything you want to with the teeth. And you can move groups of teeth out, in, out, slide them backwards, forwards, and they don't even teach this in the dental schools. Kids that lose their 6-year molars, that's a shame. They don't brush them good when they're young. And you've got a second molar and a wisdom tooth back here. Move the tooth into that spot. But when you do it, have everything on there to start with. Then you extract the bad 6-year molar, and you put your TAD in here to keep, if you don't want to bring the front teeth back at all, you put the TADs in, have that done and bonded to that tooth in front before you take it out, or be careful with it. If you want to bond it later, I mean, that time you can do it after you remove it, but put this on the same day you extract the tooth, and you can bring the second molars and the wisdom teeth up behind that, fill it up, and I'll tell you, you can look at that bone structure 2 or 3 years later, and you can't even tell you move that. You'll think that that's a 6-year molar and a second molar rather than a second molar and a wisdom tooth. So there's just unlimited uses for these screws. So learn to use them. They work out in orthodontics. So thank you for watching, and I hope you will get some ideas from this. And if you get into this adult orthodontics, which you learn, you do this in young people, and you keep getting them older and older, and then you'll gradually get off into some adult stuff, and the amount of people out there, adults, that need orthodontics is just unlimited, and we're not hitting that market at all. And learn how to do orthodontics. You can straighten old adult people's teeth about as fast as you can children. And so we've done a lot of adult stuff. You can look at that in all these videos we've done. So I'm going to say goodbye and thank you for watching, and I'll close out. But get ideas. You can figure out what you want to do with these teeth, and you can make the teeth do it. So I'm going to close out. Thanks for watching, and I hope to see you again.